I'm Joe Middleton from Primary Care and Public Health at Brighton Sussex Medical School. I'm going to talk you through some findings from work funded by Sussex Sustainability Research Programme and the Darwin Initiative that has been collaboratively mapping evidence from 43 projects across 22 countries that have integrated medical service provision and nature conservation between 1980 and 2022. So, biodiversity protection is fundamental to human well-being, and in turn, serving human health in medically underserved areas can sometimes strengthen conservation. We have collaboratively mapped the evidence on projects worldwide that are or have been providing health services with the intention of producing conservation outcomes in addition to health improvements. This exercise was started by some of us involved in integrated health and conservation projects in Papua New Guinea, Indonesia, and Uganda. Our collaboration has now widened to include contributors from 46 organisations worldwide. Scoping indicated many NGO projects are never published in the academic literature. So to avoid missing such interventions, we asked conservation staff worldwide to contribute data online or through Zoom calls. Advertising to join the collaboration was through formal networks such as the International Union for the Conservation of Nature and Planetary Health Alliance, professional contacts, funders, and a call published in the Lancet Planetary Health. Additionally, data and literature were synthesised from libraries and data sets of collaborators at Population Reference Bureau, Sussex Sustainability Research Programme, and Ecological Levers for Health. So, in terms of our findings, 43 projects from 22 countries fitted inclusion criteria. Approximately half had not been published in the collected literature, with data only available through direct submission by collaborators. The most represented region was Sub-Saharan Africa, with 27 projects, followed by Southeast Asia and South Asia. Tropical wet forest was by far the most common habitat, followed by tropical dry forest, coral reef, and tropical grasslands. So interventions which we mapped were quite diverse. Projects ranged from basic health interventions bolted onto pre-existing conservation programs to generate goodwill, such as vaccination rounds bordering parks, to complex schemes driven and funded by concerns for human welfare as much as conservation. Making family planning methods available was marginally the most common health service provided, but most such projects also delivered other medical interventions. Multiple projects operate primary care clinics. One has built a district hospital. In addition to medical provision, most projects included conceptual links to support health by preserving health-related ecosystem services. In terms of the effectiveness and evidence quality, we found good quality project evaluations have already demonstrated that integrating medical provision and conservation can be highly effective, and other such evaluations are underway. However, some projects lacked reliable methods to measure outcomes or ascertain whether links posited in theories of change between health and conservation components actually held. And you can see in this figure the relationship between conservation outcomes and health outcomes, with the numbers in the boxes representing the number of projects which had both those outcomes along the vertical and horizontal. So our interpretation and next steps for this work. Well, synergistic action on conservation and medical provision can be highly effective, and the approach is much more widespread than literature would indicate. However, funding is usually provided on a siloed basis for either health or conservation, which is a barrier to wider adoption and improved evaluation. To tackle this, funder engagement and development of evaluation guidelines are planned. We will soon be publishing our full results and intend to repeat mapping every 2 to 3 years. This mapping has only been possible by the involvement of collaborators from across the world. As you can see from this slide, we have people from a wide range of institutions involved, but we are sure that there are many projects which we are still to pick up. And so if you are aware of an integrated health and conservation project, or you've worked in one, please get in touch, as we're looking to continue expanding the collaboration with repeated mapping over the next few years. Okay, thank you.